card number 1, note card number 2. Good evening. My name is Tracy Brown, and today I'm going to talk to you about something very important: childhood vaccinations. I recently received a notice from my daughter's high school saying that she was past due on one of her vaccinations. At first I was annoyed because I thought she was up to date on everything, but then they told me if I didn't have her vaccination done within a certain time period, she wouldn't be allowed back into school. Then I became frustrated that I would have to take off work, take her out of school, make a doctor's appointment, just the inconvenience of it all. So I thought I would be proactive and go online and make sure that she wasn't behind on any of her other vaccinations, so that if she was, I could go ahead and take care of it at the same time. As I started to do a little research, I was actually surprised at the information that I learned and how important it is to get your children vaccinated. Today I'm going to talk to you about some of the information and let you know the importance of getting your child vaccinated. So what exactly is a vaccination? According to vaccineinformation.org website, this is how it all works. You're born with certain immunities in your body that are passed on from your mother. As germs start to invade your body, hopefully these immunities are built to fight them off. Sometimes they're not, and you become sick. As you become sick, your body fights and starts to build antibodies. These antibodies stay in your body for the rest of your life. Once you've built them, they don't go away, and they should fight against that disease ever coming back again. A perfect example would be chickenpox or the measles. Once you have that disease as a child, usually, your body builds these antibodies and it fights it off from ever getting again. That's why you only usually have it one time. So I started thinking, why couldn't we get these antibodies in your body, in your system, without having to get this disease? Wouldn't that be nice, so your body doesn't have to be sick to build the antibodies to fight it off? Well, you can. It's called a vaccination. That's what a vaccination does. It gives you a small dose of the actual disease so that your body can prepare these antibodies to fight it off if that disease actually does come and invade your body. I started thinking about some of the diseases that are out there in the world today. There's cancer, there's diabetes, Alzheimer's, all these diseases that we can't control. Why wouldn't you, as a parent, want to prevent your child from diseases that you can control? Some of the diseases that are prevented by immunizations include polio, rubella, mumps, measles, tetanus, diphtheria, rotavirus, HPV, and pertussis or whooping cough. Well, a lot of these diseases aren't real active today. We see, various outbreaks here and there. There are a couple that have been in recent news that we've seen more of in the last couple of years. I'm going to talk about 2 of those. One of them is the HPV, human papilloma virus. According to the website teenhelp.com, there are over 40 strains of the HPV virus. It said that 50% of teenagers that are sexually active carry the virus currently, and if untreated can lead to genital warts and eventually can lead to cervical cancer in women. If it just took a shot to prevent cervical cancer in your future, wouldn't you want to do that to protect your children? It's recommended on the website that girls start the vaccination at age 11, even if they're not sexually active. And it's a series of 3 shots that have to be given over a 6-month period. That's all. Another disease that's real current that we're seeing a lot of is pertussis or whooping cough. Whooping cough causes extreme coughing fits for several minutes at a time, and also is accompanied by a high fever. It's said on the CTC, Centers for Disease and Control Prevention website, that these outbreaks of whooping cough tend to come every 3 to 5 years. They'll see an outbreak. Just to give you an idea, back before vaccinations were given, in the year 1934, there were over 265,000 reported cases of whooping cough. Once vaccinations started in, for example, 1991, that number dropped to only 2,700. So you can see the effects, the positive effects of these vaccinations. While vaccinations might not be for everybody, Some parents choose not to vaccinate their children, and because of that, we are starting to see a rise in whooping cough. It's starting to make a comeback. In recent years, 2012, there were over 48,000 cases reported, and just last year in 2015, over 18,000 reported cases. Again, one shot can prevent this from affecting your children. Well, while I think that being a parent, you should protect your children at all costs, some parents have different views, and there are myths regarding vaccinations or getting your children vaccinated. According to an article I read on parent.com, one of the reasons that parents choose not to is there is a violation of their religious rights. Certain religions that people practice don't agree with going to visit doctors or taking medication. Other people feel that it's freedom of choice. Some people are anti-doctors or anti-pharmaceutical companies. In my opinion, your children should be your priority and over any cause that you have. Another reason that people tend not to vaccinate their children would be for financial reasons. People say that they can't afford it, they can't afford the doctor's visits, and so forth. Well, most insurance companies cover vaccinations 100%. There is also an organization, Immunize for Good, which is a non-for-profit, federally funded program that gives vaccinations free of charge to doctors for low-income families. And many of you have probably seen the commercial for Walgreens, the initiative that they've just started, that every child that receives a vaccination, they give a free vaccination to a child in a third world country. You're not only helping your own children, but you're helping children that might not have those advantages. Another reason that parents choose not to vaccinate their children is they believe that the vaccinations include toxins. That's not true. Almost 85% of all vaccinations are made up of water. And one other reason is they say that the effects of the vaccinations are more harmful than actually getting the disease. In very few circumstances when people did have side effects from the vaccines, it was very minor, low-grade fever for a couple of days and soreness in their arms. So you can see that getting the vaccination, the advantages far outweigh the disadvantages of not getting them. We all have a public health commitment to our communities. It's our job as a parent not only to protect our children, but to protect the diseases that could be spread by our children to other people. There are people out there that have immunity diseases, or elderly or children who haven't built their immunities up to prevent these diseases from attacking them. I've printed off from the American Academy of Pediatrics a chart that they recommend. This is a list of all of the vaccinations that are available to prevent these various diseases, and it also gives a recommendation at what age your children should receive these. It's our job as parents to be proactive and make sure our kids are getting these vaccinations to protect them and those around us. Please do your part. Thank you.